Did you know that nearly 70% of heart attack sufferers experience subtle warning signs up to a week before the event? This startling statistic should make you rethink your approach to daily health and wellness. Recognizing these heart attack symptoms early can be the key to heart attack prevention. Stick with us until the end of this video, where we'll reveal the 5 critical symptoms to watch for and share a real-life example that could save a life. And if you find this information helpful, don't forget to like, subscribe, and share this video with someone who might benefit from these life-saving insights. Heart health is something we often take for granted until a crisis occurs. We're going to talk about the often overlooked topic of pre-heart attack symptoms, the subtle signs that can show up as early as 1 week before a full-blown heart attack. Recognizing these warning signals early on isn't just about being informed, it's about taking proactive steps to protect your life. Understanding these symptoms can empower you to act quickly, potentially avoiding a catastrophic event. This is why heart attack prevention and heart attack awareness are crucial for everyone, regardless of age or lifestyle. There's a common misconception that heart attacks occur out of the blue, suddenly, and without warning. However, recent studies have shown that many heart attack patients experience subtle changes in their bodies long before the event occurs. These early signs, which often include shortness of breath and chest pain, are frequently ignored or mistaken for less severe issues, leading to missed opportunities for early intervention. This delay in recognition and treatment can make the difference between life and death. It's time to debunk the myth that heart attacks are always sudden, and instead focus on the early indicators that, if recognized, can prompt immediate medical attention and possibly prevent disaster. Here are the 5 specific symptoms you should be aware of in the week leading up to a potential heart attack. Each symptom is complex and deserves your full attention, as early detection can be crucial for heart attack prevention. Unexplained fatigue and weakness. Over the course of a week, you might notice a significant drop in your energy levels. This isn't the typical tiredness after a long day, it's a profound, all-encompassing fatigue that makes even simple tasks feel overwhelming. You may feel unusually weak, with a sense of lethargy that doesn't improve with rest. This fatigue can result from the heart struggling to pump blood efficiently, reducing oxygen delivery to your muscles and organs. Additionally, many individuals report feeling lightheaded or dizzy, which can further indicate that your heart is under stress. If you experience a sudden loss of stamina, difficulty concentrating, or an unexplained sense of exhaustion, take it seriously. This is not just everyday tiredness, it could be a sign that your heart is not functioning properly. Seeking medical attention at this stage could help in making lifestyle changes for heart health before the situation escalates. Shortness of breath is another key warning sign that often appears in the days leading up to a heart attack. If you find yourself getting winded from activities that were once easy, such as climbing stairs or walking briskly, this could be an early indicator of cardiovascular stress. This symptom occurs because your heart is not able to pump blood effectively, leading to a decrease in oxygen levels in the bloodstream. The reduced oxygen can cause you to feel breathless, even when you are not engaging in strenuous activities. Many individuals also report feeling anxious or having trouble sleeping due to their breathing difficulties. If you notice that you are gasping for air more frequently or feeling a tightening sensation in your chest when breathing, do not ignore it. Addressing this symptom early is crucial for heart attack awareness and seeking timely medical intervention. If you're finding this information valuable, don't miss out. Subscribe now for more life-saving health tips and expert insights. While many associate chest pain with the dramatic onset of a heart attack, subtle chest discomfort can be an early warning sign. This discomfort might not be the classic, crushing pain often portrayed in movies. Instead, it could be a dull ache or a feeling of tightness that comes and goes. Some individuals describe it as a pressure or heaviness that doesn't go away, even after resting. This sensation can be the body's way of signaling that the heart muscle is not receiving enough oxygen-rich blood, possibly due to a partial blockage. Some people also experience pain that radiates to the shoulders, arms, neck, or jaw, further complicating the diagnosis. Recognizing and addressing this symptom early can be crucial in preventing a full-blown heart attack. If you notice recurring or persistent chest discomfort, seek immediate medical advice to determine if it's related to heart attack symptoms or another cardiovascular issue. It might be surprising, but digestive issues such as indigestion, heartburn, or a feeling of fullness in the stomach can be early signs of heart trouble. The vagus nerve, which connects the heart and digestive system, can sometimes transmit signals from the heart that manifest as gastrointestinal discomfort. Over the course of a week, if you experience persistent nausea, bloating, or unexplained stomach pain, it could be your body's way of indicating that the heart is under stress. Some individuals even report vomiting or a loss of appetite without any apparent reason. These symptoms are often misinterpreted as simple digestive problems, leading to delays in seeking the necessary medical intervention. Being aware of this less commonly known heart attack symptom could save your life. Experiencing an irregular heartbeat or palpitations is a major red flag that should never be ignored. These sensations might feel like your heart is skipping beats, fluttering, or beating too rapidly or erratically. Such disturbances can be a sign that your heart's electrical system is compromised, which can be a precursor to more serious cardiac events. Over a week, if you notice that your heart feels off, whether it's racing unexpectedly, pausing, or pounding too hard, this symptom must be taken seriously. It can indicate underlying issues like arrhythmia, which may escalate quickly if not addressed. Seek immediate medical attention, as monitoring and making necessary lifestyle changes for heart health could significantly lower your risk of a heart attack. Recognizing these early heart attack symptoms can be life-saving. Here's a quick recap of the 5 warning signs. Unexplained fatigue and weakness, persistent tiredness that doesn't improve with rest. Shortness of breath during routine activities. Difficulty breathing during everyday tasks. Chest discomfort or pain. Subtle, persistent pressure or tightness in the chest. Digestive disturbances, unexplained indigestion, heartburn or stomach discomfort. Irregular heartbeats or palpitations. Abnormal heart rhythms that feel erratic or too rapid. We'd love to hear from you. Have you ever experienced any of these symptoms, or do you know someone who has? Share your thoughts in the comments.
Did you know that every 40 seconds, someone in the United States has a stroke? Even more alarming, strokes are a leading cause of long-term disability and the 5th leading cause of death. Despite these staggering numbers, many people do not recognize the warning signs of stroke, and precious time is lost before getting medical help. Acting fast can significantly improve survival chances and reduce the severity of long-term complications. Would you be able to recognize the warning signs of stroke if someone around you were having a stroke? Knowing what to look for can mean the difference between life and death. Stay with us until the end to learn these critical stroke warning signs, and be sure to like, share, and subscribe. This information could save a life. A stroke happens when blood flow to the brain is interrupted, either by a blockage, known as ischemic stroke, or by a burst blood vessel, known as hemorrhagic stroke. When the brain lacks oxygen and nutrients, brain cells begin to die within minutes. The key to reducing damage? Immediate action. Recognizing the warning signs of stroke early and getting emergency medical help can drastically improve survival rates and stroke recovery outcomes. Let's break down the essential signs you need to know and how to prevent stroke by addressing key stroke risk factors. Time is critical when it comes to strokes. The sooner treatment begins, the better the chances of minimizing brain damage and disability. Delays in recognizing symptoms and getting help can result in severe consequences, including permanent paralysis, speech difficulties, and even death. Many people fail to take action because they don't recognize stroke warning signs, or they wait too long to seek medical help. This is why learning these early warning signs of stroke now is crucial for yourself and your loved ones. The FAST acronym is the easiest and most effective way to remember stroke warning signs. Here's what each letter stands for, with a deeper breakdown of each symptom. F. Face drooping. One side of the face may droop or feel numb. A person having a stroke might struggle to smile evenly. This happens because a stroke can cause muscle weakness or paralysis on one side of the face, making it difficult to move certain facial muscles. Example: ask the person to smile. If one side of their face droops or appears lopsided, this could be a sign of a stroke. Their eye or mouth may also appear uneven or slightly distorted. Why does this happen? A stroke can affect the brain's ability to control the muscles in the face, particularly if the stroke occurs in the region responsible for movement. What to do? If you notice this symptom, take it seriously and check for additional stroke warning signs before calling emergency services. A. Arm weakness. One arm may become weak or numb, making it difficult or impossible for the person to lift both arms evenly. Weakness in one arm is a telltale stroke symptom that should not be ignored. Example: ask them to raise both arms. If one drifts downward, cannot be lifted, or feels extremely weak, this could indicate a stroke. Why does this happen? The part of the brain that controls muscle movements may be affected by the stroke, reducing control over one side of the body. What to do? Don't assume the weakness will pass. If arm weakness is sudden and unexplained, seek emergency help immediately. S. Speech difficulty. Speech may become slurred, or the person may have trouble speaking or understanding speech. They may struggle to form words, repeat themselves incorrectly, or be completely unable to communicate. Example: ask them to repeat a simple sentence like, "The sky is blue." If their words sound slurred, garbled, or confusing, get help immediately. Why does this happen? A stroke can affect the brain's language centers, leading to slurred speech, difficulty understanding spoken words, or the inability to speak at all. What to do? If someone suddenly struggles with speech, even if they recover moments later, it's a serious warning sign of stroke. Call 911 immediately. If you're finding this information valuable, don't miss out. Subscribe now for more life-saving health tips. T. Time to call 911. If you notice any of these signs, even if they go away, call emergency services right away. Every minute counts in stroke recovery, and quick action can reduce the impact of the stroke. Other possible symptoms. While FAST covers the most common symptoms, strokes can also cause sudden confusion or trouble understanding, sudden severe headache with no known cause, dizziness or loss of balance, and blurred or double vision. Early warning signs of stroke weeks or months before. Although strokes often strike suddenly, warning signs can appear weeks or even months beforehand. Recognizing these early symptoms can lead to life-saving intervention. 1. Transient ischemic attacks or TIAs mini-strokes. TIAs cause temporary stroke-like symptoms that last minutes to hours, but resolve on their own. Despite their short duration, TIAs are a serious warning. 1 in 3 people who experience a TIA will have a major stroke within a year. 2. Unusual fatigue and confusion. Persistent fatigue, brain fog, or difficulty concentrating can indicate poor blood circulation to the brain, an early warning of a possible stroke. 3. High blood pressure and severe headaches. Hypertension damages blood vessels and significantly raises stroke risk. Sudden, severe headaches resistant to painkillers could signal an impending stroke. 4. Vision problems and loss of balance. Blurry or double vision, sudden sight loss, and unexplained dizziness can mean reduced blood flow to the brain, increasing stroke risk. 5. Numbness or weakness in the limbs. Intermittent numbness or weakness, especially on one side, can precede a stroke. If you notice these symptoms, seek medical attention immediately. Imagine you're having coffee with a friend, and suddenly, they begin slurring their speech and struggling to hold their cup. Would you recognize this as a possible stroke? A real-life case involved a 62-year-old woman who suddenly couldn't lift her left arm and had difficulty speaking. A bystander recognized these early warning signs of stroke and immediately called 911. Thanks to the quick response, doctors administered clot-busting medication within the critical 3-hour window, saving her life and minimizing long-term effects. This story is a powerful reminder. Spotting the warning signs of stroke and acting fast can save a life. To recap, remember the fast warning signs: face drooping, arm weakness, speech difficulty, time to call 911. Also, be aware of the early warning signs that can appear weeks or even a month before a stroke occurs. If you found this information valuable, leave a comment below and let us know. Did you learn something new? Have you or someone you know experienced a stroke? Don't forget to like, share, and subscribe to spread this life-saving information. If you want to learn more about stroke prevention, heart attack risks, and overall cardiovascular health, be sure to watch this next video.